First of all, I'm also ashamed of that you voted still to continue funding for ACORN. And what you just said, your comments, you're not convicting them and we're not expecting you to convict them. The judicial branch can do that, but you don't have to fund them either. It's a systemic problem with ACORN. 6 places throughout the country have done this. It's not just the bottom people. This is systemic. So I charge you, I'm sworn to uphold the Constitution as a law enforcement officer. I charge you to do the same. How fair is it for the general public also, there was just a vote, to have more than 72 hours to actually view the final version of bills that are written. This health care bill is over 1,000 pages. I think it should be online for everybody to view. And I don't think it should be just 72 hours. I think it should be a week so people can actually look through this. Because half of the people don't know what's even written in it. Furthermore, I would like to say I'm against government-run health care in any form. I challenge you to look in the Constitution and say where exactly it even says the federal government is supposed to be involved. Article 1, Section 8 clearly specifies the spending by the federal government. The general welfare exception is a faulty argument because then it would list in the 18 other items what the federal government could spend money on. Health care is not in there, and many of the other issues are not in there. And that being said, according to the 10th Amendment, this is all issues that should be handled by the states. Furthermore, this bill will lead to government-run health care. Private insurance companies can't compete. And it's easy to say that, but think about the people they have to employ. The government just has to raise taxes. The insurance companies have shareholders and people they're accountable to. Also, what's going to solve the health care problem? First of all, malpractice and tort reform. I've talked to many doctors who say they can't afford to practice. If this passes, I think the estimate's 45% of doctors are going to leave medicine because they can't afford it. Malpractice insurance on average for OBGYNs, for example, is $100,000 to $200,000. That's a reason for a lot of healthcare costs. I mean, furthermore, government mandates is another problem. Why should someone who's had kids, who is not going to have any more kids, pay for prenatal care or something? Government mandates are part of the problem of this, and they've created the problem. If you want to pass a law, number one, eliminate government mandates. I can tell you California is a prime example. Wisconsin's the same. There's over 1,300 insurance companies in the United States. Well, California, I'm not sure what the number is in Wisconsin, but it's along the same lines. There's only 6 health insurance companies people can choose from. That's why there's such an increased cost in health care. So, I mean, eliminate the mandates. Let people go outside to get Finally, on health care, if you pass a law and want to pass a law, why don't you make all the procedures and the cost published so people know what they're paying for to get what the health care they want. LASIK surgery is a prime example. Over the years, the decrease in cost for LASIK surgery, because of a free market solution, has decreased over 30%. That is how you solve health care. I have a petition here, signed by many people, which I'd like to give to you, but I'm not done, so can't kick me out yet.
Yeah, time limit. Big time limit.
That doesn't want, these people don't want government-run health care, and based on all the estimates, that's what's going to happen with this public option. It's going to lead to that. Furthermore, I wanted to talk about cap and trade really quickly. First of all, I think this is a non-issue, and I encourage you to look up Dr. Willie Soon's research from the Harvard Center for Astrophysics. Carbon dioxide concentrations in the atmosphere have been steadily increasing, yet the world hasn't warmed for 10 years. So, how many people can actually say global warming is a problem? I don't think it is, and I think we're spending tons of money on a non-existent problem. Yeah. And on average, this is going to cost the average family about $3,100. It's basically a tax on energy. And again, you do that, it's passed along from the companies, it's passed along to us. Jobs are going to continue to leave this country and this state, and we can't afford it. People are losing their jobs. You're basically taxing people out of their homes and, taking away their prosperity. And they're going to go to other countries where that are competitors for everything. So that's what I wanted to say about cap and trade. And finally, I don't want to see amnesty. I don't want to see anything like amnesty for illegal immigrants. We need to secure our borders.
Yes. Yes. Next we have Sally Horton.
Thank you very much, Tammy, for listening to me. Pretty much Dan covered all my points, so I just would like to stress that I am a nurse, and every day that I go to work, I deal with government interference through Medicare, Medicaid, and I have horror stories of how our World War II heroes are being treated at the VA. We had one gentleman who was kept waiting a total of 6 hours, A, waiting to be seen, and B, waiting for transportation. Anytime the government touches anything, it just turns to, well,
Kirsten Lombard. Welcome, Kirsten.
Thank you, Representative Baldwin. Spending in this country is out of control. I think everybody in this room can agree on that. And yet, like the girl from the song, you simply can't say no. You seem to be on board with any piece of legislation or initiative that would cripple this state further and the nation. You love to spend our money. We've had it. Cap and trade, which has failed miserably in Europe, is projected to cost billions. It has failed elsewhere. Why would we want to implement a system that has failed miserably somewhere else? We will lose jobs in this state. We will watch your constituents have to find money to pay energy bills that they cannot pay. Where are we getting the money to do this? Barack Obama himself is on record as saying that under a cap and tax plan, energy would skyrocket.
That's right.
We don't have the money. It's not in our pockets, Representative Baldwin. No cap and tax. Healthcare reform is something we all want to see. We all want to see. Nobody in this room wants to see people without healthcare coverage. Nobody. We're not hard hearts. Why, Representative Baldwin, do you insist on pushing for a plan that is going to bankrupt us all? We have heard from the CEO. Call it public option, call it whatever you want. It's government-run health care, and it is going to cost trillions of dollars, according to the CBO. Why would you continue to push for that plan when there are free market solutions, Representative Baldwin, that allow us to solve welfare without having a single public dime? Not a single dime. And as for your explanation about why you would vote to continue to fund ACORN, that was one of the most disingenuous and frankly hypocritical responses I've ever heard. Where were you on Bill of Attainder, Representative Baldwin, when many people on Wall Street who had legitimate contracts were being told that they had to give money back because of your populist stance? Opposition to the people of this country, and you certainly stand in opposition to your constituents who need your help now. Start saying no, Representative Baldwin.